This is John Pinelli, financial representative, talking to you today about elderly supplemental health insurance. Medicare will provide coverage for a lot of senior citizens or elderly persons in the form of Medicare Part A, which provides for inpatient services. However, oftentimes this will not be enough to cover all medical necessities of an elderly person. This is where the need for supplemental health insurance may come into effect for an elderly person. They may want to consider looking at supplementing what they already have or what's available to them by Medicare through an outside carrier. Now, this can be done fairly affordably depending on your medical history, family history, etc. But most individuals who just plan to supplement it rather than looking for a broad-based health insurance plan can do so at a fairly cheap rate. Some resources that might be available to seniors looking at this type of coverage would be considering possibly Medicare Part B, which would cover some outpatient services and would provide a more comprehensive coverage. Medicare Part B is not free, but the premiums are fairly inexpensive, and if you qualify, it tends to be a really good deal. Other resources that will be available to you would be the AARP, which can provide you with a lot of great resources in the area of health and life and wellness in those areas. So it's important to use the resources that are out there available to you to determine where your need is and how to obtain the right amount of coverage that fits you the best. So this has been John Pinelli, financial representative, talking to you today about supplemental health insurance for elderly.